if it is clear, whether it is clear or not. And hopefully, thank God. Okay, then we'll see for a few more, just one more minute, and let people join. Good evening. Hi Praneeth. Hi Mini. Hi Sudhanshu. Hi Swati. Hi guys. Okay then, as I was asking, what is the culture method used in kidney boils, or you said agar is right, Muller Hinton agar, and can you tell me what is the culture method you will use in kidney boils method? Yeah, agar is correct. I'm asking about what type of culture you will do. Yeah, great invisible mania. It is lawn culture, correct? Okay. Yeah, great Swati, correct. It's lawn culture, and yeah, it is lawn. And can you tell me if the graph height is okay? Bye, Praneeth. If the height of the graph is more, if the drug is efficient or potent, efficacious or potent. I mean, how do you tell in a graph whether it is efficacious or potent? Yeah, you are right, Shelby. It is efficacious, and if it is more to the left, then yeah, Praneeth, you are right. Correct, guys. Nice. Okay. Can you tell me which drugs are used as transdermal patches? Transdermal patches. Left is potency. Correct method. Can you tell me which drugs are used as transdermal patches? Great. And yeah, IOC. You asked me. Fentanyl. Correct. Rivastigmine, fentanyl patches. Okay. Fentanyl, yeah. Scopolamine, nicotine, yeah. Well done. Then coming to, yeah, correct. Can you tell me what is the drug of choice for you know local anesthetic toxicity? Local anesthetic toxicity. Can you tell me which drugs cause gynecomastia? Which drugs cause gynecomastia? Yeah, 20% intralipid emulsion. Can you tell me which drugs cause gynecomastia? Please elaborate, Subhan. Correct. Yeah. Yep. Correct. What is D? What is I? Yeah, ketoconazole, digoxin, estrogen, cimetidine, great. Spironolactone, great. Not just pharma, but because people have asked yesterday, I was just going through some of them, and I'll go to other subjects too. Just wait a little bit. Okay. Okay, I will tell you the antibiotic. You have to tell me something about it. Okay, some anything that you know about that drug. Starting with aminoglycosides. Can you tell me what do you know about gentamicin? Gentamicin. Uh, Hi Abhi, thank you so much. Try to answer. Big party for me then. If it is helpful for you in any way, great. Ototoxicity, nephrotoxicity, correct. It is for all aminoglycosides. What is so specific about gentamicin that you should know? Wash is only. Just go and wash. Yeah, yeah, very nice mini. That is what I was expecting. Yeah, in last resort of miniers, we use, intra-auricular. Cannot be used in anaerobes. Okay, that is something new for me. Uh, okay then, protein synthesis inhibitors. Ototoxic. Okay. Yeah, that week through round window. Correct me. That was what I was expecting. Then uh, Lord Shiva, there's one thing that I wanted to tell you that only one thing that I never forced anyone to come to this Q&A. In fact, people have asked me to make this Q&A sometimes. So I don't want any one of you to get into FOMO. I just want to use it as a learning tool like custom module or any other thing. If you are not able to revise, just go through it once again and you will be sorted. That's it. It is not to create FOMO but to make you learn. And I never wanted to make people feared or make people anxious. In fact, I want to do the opposite. I don't know, but having said that, I don't know. Please let me know if you don't want these live sessions. If you are having this FOMO, maybe you should leave this live. That is better. You can join. Okay. Yeah. Okay. I was asking something, right? I'm so sorry for deviating, guys. Okay. After gentamicin, can you tell me any one thing regarding neomycin? Neomycin. Hi Krish, good evening. Okay Swati, okay Mini, then thank you. Yep, yeah. Yes. Okay. I was asking about neomycin. Hi Aarthi. For asthmatic patients, no, you know something. I was just asking my friend too regarding this question. So, neomycin is seen somewhere. You know it, but you can't recall it. That's it. Let me know. When I say it, you will say, yes, I have heard of it. Okay. Can you, I will give you something. It is related to gut bacteria, liver patient. Can you now tell me where it is seen? What is Staph aureus carrier? Is there any Q&A going on? I didn't see. No, Shiva. I want you to answer this, whatever it is. If it is wrong or right, I am not, scolding you or fighting with you or I'm not doing anything like that, right? You can just answer. No one knows who you are, so just answer, okay? Okay. Okay, then neomycin is something related to hepatic encephalopathy, guys. Hepatic encephalopathy. Just go through it once. Neomycin will stop the gut bacterial growth. Gut bacterial growth will give more ammonia. That is why to reduce that, gut bacteria will be killed by neomycin. In SBP, maybe the same reason, but it is most commonly used in hepatic encephalopathy. I hope you learned something. Then after gentamicin, neomycin. Yeah, I will write, but I don't know if it is of significance and you can clarify it for me. I will write because I have already annotated some of them in my notes, PPs and BS. Okay, then learn it. Okay, is it contraindicated, and is it of significance? Okay. Coming to the next drug, what else we have? Gentamicin, neomycin, and just a second. Disorder of what else? Can you tell me what aminoglycosides are there? Examples of aminoglycosides? Surgery, I'll get back to it. Yeah, wait. Okay. Because somebody have asked to ask from pharma, that is why. Okay, then we'll shift back to surgery for a while. Can you tell me what is you know okay, what is shock index? Can you tell me shock index? Nobody is scolding you, Shiva. We just want you to learn something, or if it is giving you FOMO, just leave it. That is what I am telling you. Ask Mini. If I know, I'll try to answer. For this, I think, yeah, heart rate by SPP. Okay. Most common site for pulmonary catheterization. Most common site for pulmonary catheterization. Okay. It's okay, it's fine. This shock index is SBP, and mean arterial pressure is modified shock index. Just remember it now. Heart rate by SBP is shock index, and heart rate by mean arterial pressure is modified shock index. Yeah, I think it is subclavian because we go through right atrium and to left atrium via subclavian. I'll just clarify it in 1 second. Just wait. Surgery is here. I think it's anesthesia, right? Wrong search, basically. Yeah. I'm sorry. I was asking Swan-Ganz catheter. He's right. It is through pulmonary artery. Sorry for that. It is not vein. It is pulmonary artery. I was little confused there. Yeah. For TPN, it's IJV. And infectious, like which will cause infections if we okay. Yeah, femoral is highly infective, and for TPN it is subclavian vein, and overall for central line it is IJV. Okay, central line it is IJV, and for TPN it is subclavian. Okay, just remember that I was little confused. I hope this is clarified. Okay, if you have any doubt, please let me Summary is for Swan-Ganz catheter, it is pulmonary artery we will choose. Okay, and for venous catheters we use internal jugular vein most commonly, and for total parenteral nutrition we use subclavian vein. Okay, that is a controversial question, Minnie. I heard it as 2-finger breadth, but I don't know. After 24 hours it is 1. After 2 days it is 2. Yeah. That is what I am trying to recall actually, between subclavian and right atrium. I just forgot. I think it is PCWP, pulmonary capillary wedge pressure is what is measured between SVC and right atrium. Please let me know if I am wrong. Okay. Guys, just leave the controversy ahead. Coming to surgery, can you tell me what does minocycline do? Minocycline do? Yeah. Yeah, black thyroid, great. Nope. Yeah, black thyroid, great, guys. Can you tell me which is painful and which is painless among lymphocytic thyroiditis and decurrent thyroiditis and granulomatous? Can you tell me which one is painful and lymphocytic thyroiditis among these two? Yeah, minocycline one. Yeah, I think it is PYQ, Krish. Decurrence is painful or painless, and lymphocytic is painful or painless. Yeah, decurrence is painful, guys. Great. And what else? Lymphocytic is painless. Okay. Can you tell me what is the mutation for follicular thyroid carcinoma, and what is the mutation for papillary thyroid carcinoma, and which is lymphocytic spread and which is hematogenous spread? Yeah, Praveen, I'm Telugu person. I'm asking in terms of cancers, Krish. Great. Right. Follicular, papillary is bra, and follicular is that. Correct, guys. Okay. Follicular is hematogenous and papillary is lymphoid root. Okay. As we have discussed, cyst trunk surgery. Paxate for follicular, correct. PPAR gamma and Paxate, right, for follicular. Is it for papillary? Is red also present? Yeah, thyroglossal cyst, correct, guys. Can you tell me where do you do pyloromyotomy? Ramstad's pyloromyotomy. some answer is leaked actually. Ramsted's operation, yeah, CHPS. And can you tell me what do we do for eclasia cardia? No, no, not for cholesterol drug. PPR gamma mutation, PPR gamma paxate mutation. Is it? Am I stuck? CHPS. Okay. Am I stuck so much? Uh, yeah, Hell's myotomy. Okay. Can you tell me what is the characteristic finding in eclasia cardia? Characteristic finding in eclasia cardia. Yeah, I think it is esmolol, medical 11. It is esmolol, right? Yeah, bird beak. Okay. Great. Okay, then bird beak sign. Can you tell me which drug causes Clostridium difficile infection and what to do for it? Drug of choice for Clostridium difficile infection. Yeah, clindamycin. Yeah, fidaxomicin. Great. Can you tell me which sign is seen in clindamycin infection? Which sign do you see? Which sign do you see? Accordion sign. Great. Then in you know, Clostridium difficile infection, pseudomembrane colitis. Okay, then can you tell me what is O antigen for typhoid and what is H antigen for typhoid? O antigen and H antigen, 1 to 2 points for them, vital test. Somatic, great. H is great. Okay. Okay. Correct, guys. Good. Can you tell me this okay? Okay. Where do you see owleye appearance? Owleye appearance. Yeah, only. Why do you ask, Krish? Yeah, CMB. Where else we see owleye? I just couldn't recall. Please let me know. Yeah, Hodgkin RSS and CMB RSS and one more is there. I couldn't recall it. Please let me know if you guys recall. Great. Okay. As we are near our RSL, let's revise Hemat for some time. Can you tell me pleomorphic RSL is a feature of? Pleomorphic RSL is a feature of? Yeah. Is it? Are you sure? Because I will remember it now. Vertebral metastasis. Oh, like okay. Can you tell me where else we see pleomorphic? No, it is not mixed cellular. Lacunar is for nodular, so it is not for pleomorphic. Not mixed cellular, yeah, somewhere near lymphocytic. I think it is lymphocyte depleted, guys. Please, revise it once again because pleomorphic is also known as mummified RS cell. Mummified meaning I think it is depleted. Please check it once. Yeah, it is lymphocyte depleted. Once check it. Yeah, winking owl in vertebral metastasis. Great, 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 Shelby. Nice. Yeah, this is how I remember lacunar and nodular are rhyming words. So lacunar, nodular. Mixed cellularity is which one? I don't remember. But pleomorphic or mummified is for depleted because mummified is like everything is very thin. So that is how lymphocytic depleted. What are you confused about? Please tell me, Krish, because I'm asking the questions if I know the answer, but otherwise I'm just asking you to clarify. If you are clarified, please just get back to it, write it aside, and go back to it after the session. Okay? I can't know everything, right? I'm also a student like you, so that is difficult. I want to learn something too. I want you guys to help me too. Okay? Yeah, mixed is classical RSL, correct? It's okay, Angeline. Just keep studying. Yeah, definitely. I said it already. You guys can participate. You guys can ask. Okay. I think it is metastasis, Krish. It is not TB. Even I studied it as TB. Just let you know. I will let you know. Let me. I will just write it aside, and I will let you know. Okay. I have studied it, but just that I couldn't remember it. I have done BTR, but I have so many things which I forgot. Okay. Yeah. Then, yeah, which leukemia is most common in Down syndrome? It is AML M7, right? Correct. Yeah, AML M7. Can you tell me where else we do chloromas? Chloromas. Pandu. Cotton wool skull is in Page's disease. Is it Page's disease? DX is M3. Yeah. Chloromas is M2. Correct. Sweet syndrome is neutrophilic dermatosis, right? Pages, yeah, I think it's pages only. Okay. Can you tell me where else you see beveled margins in the skull, as we have been there? And can you tell me what is the criteria for multiple myeloma? Criteria. Sweet syndrome is neutrophilic dermatosis, right? That is what I know about sweet syndrome. If any other thing, please let me know. Yeah, Langerhans histiocytosis. Yeah, you are right. No. Most common is ALL. Less than 3 years is AML M7. Correct only, na? Is there anything wrong? Please elaborate, guys. Not crab and slim is not enough. You have to elaborate it. Krish, if anyone is answering wrong and if you feel you have a right answer, please let me know in the comments, okay? If we are wrong, we'll correct. There is nothing to worry. You have to tell it, guys. Creatinine and what else? R for what? C for what? A for and B for. B is beduria nitrogen, right? Let's decode it together. Even I forgot it. Renal failure will be there. Light chains accumulation will be there. A is hypoalbuminemia. Please clarify. Yeah, calcium. Yeah, calcium is more than 12. Correct. Calcium is more than 12, and yeah, renal failure. Yeah, sorry. Renal failure is there, na? Renal failure is there somehow. You have to take it, consider it, na, as answer. Yeah, it's calcium. Hypercalcemia, renal failure, albuminuria, and B is blooduria nitrogen only, or what else it is? Uh, bony, yes, bony lytic lesions, correct. I think it is there, just a line, but I don't remember where it is, or maybe I have annotated it, but somehow I know only that point about it. Yeah, bone lesions. Okay, guys, crab is hypercalcemia more than 12 and renal failure. A is hypoalbuminuria and bony lytic lesions. Is it correct? Slim is Li is light chains accumulation. S is uh, S I don't recall. S and M. Light chains is what I know. S is for what? And M is, please let me know. S and M. S and M. Yeah, M is MRI. Okay. S is for 60% of what? Is it plasma cells? Okay, 60% of plasma cells. Uh, IgM, na? IgM is having spike. So that means we are not having clarity in multiple myeloma. Please go back after the session and just see the multiple myeloma, Wallenstrom's macroglobulinemia all at once. Okay. A is anemia. Okay. Thanks for confirming. Okay, guys. Please check PP's MBBS journey comment once. He has elaborated it. A is not albuminuria. A is anemia. Please correct it. Okay. If you have confusion here, just go back to BTR. Is it IgG? Okay, Krish. This is okay. Maybe I'm wrong. I think IgG only cut. I'll just open the book. It's better. Okay, guys. Crab. C is hypercalcemia more than 11.5. R is renal failure, which includes creatinine more than 2. And A is anemia less than 10. And B is correct. B is bony lytic lesions in MRI. And slim is for defining biomarkers. S is for 60% plasma cells. Li is for free light chain. And M is MRI, as you guys said. And regarding this IgM and IgG, it is M protein which is involved. I don't know, it's M protein. I don't know IgG, IgM, but ma'am didn't give it like that. It's IgG or M. So if you are sure about it, guys, including if Lord Shiva is there, I don't know, but please don't consider anything. Just forget about anything. Don't worry. Just try to answer and go back. I don't know many answers. I'm just asking. Okay. Ma'am has mentioned, is it? It's fine, Krish. I'm letting you know, na. Why worry? It's not important. The content is same everywhere. Is it IgG or A? I'm confused, guys. Please let me know, or I will let you know tomorrow. Okay? Winking owl eye sign, and just don't have the pen here. Just a second. I'll write it. Winking owl eye sign and multiple myeloma, the immunoglobulin raised. I will check these 2 points. Okay. Okay, that is better. I will post it in the post section. Yeah, now you shouldn't. Please don't forget multiple myeloma from now on. Yeah, Russell bodies and Dutcher bodies are also present. And yeah, can you tell me ulcers? Longitudinal ulcers are present in which condition? Transverse ulcers are present in which condition? And flask-shaped ulcers are present in which condition? Anatomy, fine. We'll go anywhere we want. Yeah, transverse is for TB, longitudinal is for typhoid, and amoeba is for flask shaped. If anyone wants, okay. Okay. Yeah, yeah. Transverse is TB. Okay. Anatomy, someone has asked, so let me go through it. I just studied it. Can you tell me what joint is? I have recently watched a video. So tell me, I'll ask you from here to here. You have to tell me what is, you know, first sternocostal joint. I think somebody have answered it already. First sternocostal is primary cartilaginous, right? Saddle joint. I'm confused. Uh, okay. I think sternocostal is primary cartilaginous joint. Okay. And sternoclavicular joint. Sternoclavicular joint is which joint? Yeah, sternoclavicular is saddle joint. Can you tell me what is the this one? Okay. Sternoclavicular is saddle joint, correct? Can you tell me? Yeah. Acromioclavicular is plain joint, and yeah, great, ball and socket. And can you tell me what joint is elbow joint? Elbow joint. Elbow joint. Okay. Can you tell me what joint is superior and inferior radioulnar joint? Superior and inferior radioulnar joint. What joint is this? Yeah. Pivot joint, guys. Great. It is pivot, guys. What is middle radioulnar joint? Middle radioulnar joint. It is pivot, guys, from here to here. Like superior and inferior radioulnar joints are movable for pronation and supination, so they are pivot joint, correct. And middle radioulnar joint is middle radioulnar joint. Yeah, it is immovable. It is fibrous joint, correct. Can you tell me which is this joint? Wrist joint, this joint, and this joint. Wrist one and this MCP joint. Okay. Yeah, correct. This movement is ellipsoid movement. Okay. So this way we can move the leg also. So metatarso is also ellipsoid. Metacarpo and wrist joint is ellipsoid. Okay, both are ellipsoid. Correct. And can you tell me this carpal? This. Yeah, this is again hinge joint. Okay. No. I will post a picture. I mean a screenshot of some video which I have gone through in the community section. Okay, please get through it. This joint, carpometacarpal joints. I think it is saddle joint, guys. Carpometacarpal is saddle. So wrist joint is ellipsoid. Carpometacarpal is saddle, and again this metacarpophalangeal is ellipsoid, and these are again hinge joint. Okay, I don't know. Maybe post it in the group we have in Telegram. Maybe we'll see. Okay. Saddle in here is which one? You have to tell me. Malio-incudo joint, because incudostapial is ball and socket, and the other one is saddle. Okay. Yeah, it's okay to get confused. That is important topic and it's a confused topic. Okay. Yeah, correct. Saddle is malleus and incus, correct. Okay. In anatomy, can you tell me what is the movement which lowers the mandibular joint, lowers It's okay. Okay, guys, come back. Can you tell me mastoid comes from which arch? Yeah, lateral pterygoid, correct. Mastoid comes from which arch? Please don't ask marks, guys. Concentrate. Yeah, first arch. Yeah, I know everyone will tell answer that, but actually, it is a controversial question. But all M's will come from first arch, but probably mastoid along with styloid should come from second arch. It is what the resources say. According to me, it is second arch. Please clarify it because it's a controversial question. Some will say first, some will say second. Yeah, all M are one, all S are two. I know it. That is why I have asked mastoid because you will get confused too. But okay, I'm just telling you. Remember, mastoid is second arch, but just please clarify it. Okay. Okay, then can you tell me stylopharyngeus muscle comes from which arch? Stylopharyngeus, which arch? Stylopharyngeus from which arch? Yeah, it is third arch. Third, guys. It is not second, Krish. It is third arch. Okay. Yeah, it is third. Can you tell me? There is one thing here. If you can correlate, what is the nerve for third arch? What is the nerve for third arch? I've just realized while studying it, I was having that blink of it. Yeah, glossopharyngeal. Can you tell me where else we see this combo of stylopharyngeus and glossopharyngeal nerve? Stylo, yeah, I will elaborate it. Stylopharyngeus and glossopharyngeal nerve. The combo is passing through one place. That is what I have asked day before yesterday, I think. Yeah, now you don't forget what is the structure passing through it. Okay, between superior constrictor and middle constrictor we have these two structures passing in, which is a previous year question. Okay, that is how you remember. Now you don't forget both of them. Okay. uh, yeah, in superior and middle constrictor. Okay. Motel passes, as someone is asking. M is, let's do it with me, guys. M is melanocytes, melanoblasts. O is odontoblasts. T is T, tracheal cartilage. E is E. I just forgot E. So let me know tracheal cartilage. E is for enamel, correct. Enamel, and L is for leptomeninges. No. Okay. And P is for PNS ganglions, and A is for motel passes is a mnemonic for neural crust cells, derivatives of neural crust cells, Krish. Okay. P is for PNS ganglion. A is for S is for squamous cell. Another S is for spiral septum. E is for endocardial cushion. A is adrenal medulla, correct. And last S, someone remind me of it. Adrenal medulla, correct. All PNS ganglia, squamous cells completed. Yeah, it is from BTR. It's okay if you have another mnemonic for your neural crust cells. You can just tell the answer. No need to panic for mnemonic also. It is different in different resources. Okay. Yeah, PNS and head and neck derivatives. Okay. Okay. Can you also tell me things related to as we are near neural tube, can you tell me the derivatives of surface ectoderm? Can you tell me derivatives of neuroectoderm also? Or shall we skip this question and you will revise it afterwards? I'm just done with this bullshit, guys. hating this, but I don't know. Yeah, all the surface ones is all except in eye, conjunctiva, cornea, lens, surface parotid, sweat glands, mammary glands, and what else we see in surface. Another exception is pituitary gland, which is anterior pituitary. Yeah, epidermis is coming from it. And what else is coming from it? All superficial ones. In tympanic membrane, it comes from all the layers. So tympanic membrane. Here, one more thing. The outside one, external auditory canal. Okay. Okay. I hope I am clear. All three layers, tympanic membrane. Just revise it one more time. You will be sorted. Can you tell me ciliaris muscle comes from? Ciliaris muscle comes from. I have done 3 anisette, 2 neat. We have a mnemonic for neural crest. Okay. Then which one? It is neural crest. No, not neuroectoderm. Ciliaris comes from neural crest cells only, guys. Correct. Neural crest cells is the correct answer. Okay. Now, can you tell me trichophyton, epidermophyton, and that one? What type of macroconidia? What is the shape of macroconidia you see in trichophyton? And what type of which will have maximum number of microconidia? Yeah, sphincter pupillae and dilator pupillae are from neuroectoderm. Ciliaris is from neural crest cells. Okay, and extraocular muscles. Extraocular muscles come from the muscles one, the mesoderm. Okay. Pencil is tricho. Yep, correct. Yeah, spindle. Yeah, correct. Epi is both. Okay, epidermophyton is both. Okay, correct. Okay, then confuses like these. Just wanted to ask something else. Okay, last question, guys. We have discussed more than enough time. We have to study. Okay. It is club only. Club only, Krish. You are right. Club only. Correct answer. And okay. Can you tell me yeah, I'm sorry, I forgot that. Yes, you are telling the mnemonic antipituitary. Tell your eye and ear about PSM gland below peptide gland. Okay, little bit, but I remembered it as surface wala things except the pituitary one and the lens one. Glands, I know. Another one, anal canal below the peptide line. Dimorphic fungi only, na? Okay. I don't know. I too don't know. Okay. Eastern heat. Yeah. Okay, then last question. One last question. Okay. One person is coming with erythema and swelling in his finger. He is a fisherman. He is having erythema in his finger. Okay. Nothing else is given in the question. So can you tell me the causative organism for the same? Is it causative diagnosis? Sorry, what is the diagnosis? Erysipelas, erysipeloid, Staphylococcus aureus infection, Streptococcus pyogenes infection. Just on the light ones. No, it is involved throughout the pulp, from here to here. From here to here, guys. No. Erysipelas, erysipeloid, Staphylococcus aureus infection, Streptococcus pyogenes. Great, it is erysipeloid, Aishwarya. Correct, you are right. There is nothing given in the question, guys. Trust me. He has given it as a fisherman coming with erythematous infection from here to here, and they did not mention anything else. So just remember that if they did not mention anything about pus or something like that, and they give you fisherman history like that, it is erysipeloid. If they give you about pus, it can be erysipelas then, okay, pyogenes infection. Um, it is diabetes, right? Thank you so much, Ravi. Hope it helps you in any way possible. Um okay, guys, I hope this session is useful to you. Yeah. Namaste, Sain, Kiro Atropathy. In any way, if you are not able to answer any of them, just write them aside and go back to it. Please don't have the FOMO of I am not able to answer. No. There are many questions I was not able to answer. I was just not asking you guys to answer. It's okay. And when you guys tell me the answer, yeah, okay, this is what I thought. It's quite common and natural to forget things because we are humans, we are not robots. And please don't think that we are OGs or something. We are nothing but students. We are learning. Don't have any FOMOs. That is the takeaway from this session after seeing Shiva. Okay. In the question, you will not have any, such thing as margins. You can see it is just that all red, red, red. You can't even demarcate the margins there. I don't know, but maybe you can see it in diagram or not. But in the question, I didn't demarcate. I'm not able to demarcate it. No, Chris, not everyone is studying, including me. I have wasted last 1-2 days. I may waste the next coming 1-2 days because of personal thing. So I'm just telling you that you can't be perfect all the time. You can't be doing 9 to 4, 9 to 10 schedule every day and being the perfect, student and win the rank. No, it's okay. It's quite okay to waste some time, some or the other time in a day, but come back to it. Don't think about the marks. Don't think about the stress and anxiety, and come back to what you have to learn, where you are missing. If you are losing interest, go back to the PYQs, and you will literally get scared if you get wrong in them. So then you will go back to the content. Okay, I come live at 5:30. It's 121, correct, Dasari. There's lot of time scope I have to increase. I'm doing now for live. I don't know. After the Q&A, you are telling about mini. Okay then. I will from today only. I will give you 50 MCQ custom module as 100 MCQs before. You can tell me the scores. Okay. Okay then. I hope I didn't scare anyone. It's all, if you are following BTR, it's all in BTR. If you are not following, it's all in your notes. So just go back to it. Okay. That is a very big name. See what happens if you don't give up. Okay. That is ma'am's quote. I'm a fan of it. Yeah. About what I will do the live in the early morning live session, and the evening I can't promise you. I will do the Q&A, but I cannot do it afterwards. I don't know. I feel my health is deteriorated with these things, with all the stress I'm having. So please understand. I will try to do the Q&A definitely in the evening session, But in the morning, I'll definitely do the live session, and after the Q&A, I don't want to do it. Why 20 to 30 questions? You have to do 50 questions till the INE set. I mean, for next 1 week, at least for 1 week, we are gonna do. Okay. Yeah, Swati. Okay. Uh, okay, Minnie. Then I'll do it. Krish, 50 MCQs till the next week. That is our target. Um, I will include the important subjects or important topics, all the main ones. No extra things or new ones now. Okay, for next 1 week, and after 1 week you are just gonna go through the content and nothing else. Okay. No, bad idea, very bad idea. You won't increase any score. Charts and talks, just go back to your content more. Happy that it helps you, Mini. Okay then, see you in the early morning live session tomorrow, guys. Bye bye. My voice is over now, I can't do it anymore. Oh yeah. I am planning to do. I want to give a flash up of all the BTR book from starting to the end for the last 4 to 5 days, and for last 2 days I am gonna do the bookmarks, perils, and wrong ones in previous GTs, choti copy, all this stuff in the last 2 days. Hopefully, it's in God's hands. Okay. Why I will forget you? I will not forget you. You have to give interview in my channel, Krish. Everyone should try your level best, and you have to, give live interviews in my channel. Hopefully, in a good manner, and you have to tell definitely about me. Okay, some little bit, tiny bit about me. That is what I'm expecting. Okay then, bye bye guys. Uh, yep. See you tomorrow. Doesn't matter, Divya. Doesn't matter. Don't worry. I'll talk to you later, Krish. I'll see you later. Okay, bye guys.